Before I start, Lisa Hall, who's our information officer, give me a little ticking off to say, and don't forget to mention what that is behind you. So what it is people that want to donate to Sunderland Care Centre, we've established different methods for that to happen. If you want to take note of the text and so forth, because all your phones will be switched off now, so it doesn't interrupt me while I'm here. So if you want to take notes of that, that's a new way of donating money to Sunderland Care Centre. As you can hear, I've got a bit of a throat. I've had man flu, and the guys in the audience know what that's like. It's absolutely dreadful. But I'm pleased to say that the staff at Sunderland Care Centre have been really supportive.
That was for effect.
It was, yeah. Right. I'd just like to welcome everyone to the annual general meeting. It's really hard to believe that a year is gone since we were last here. I remember sitting in the audience last year, and Stuart introduced me as the incoming officer. And Stuart's also mentioned it's really, really hard to believe that in July next year, Ailsa Martin will have been retired 2 years. So, without wanting to say too much about how time moves on, it invariably does very quickly. The challenges faced by individual carers continue. Sunderland Care Centre will continue through a number of ways to support all carers we come into contact with. The last few years have seen significant progress in bringing issues facing carers to the attention of national policymakers, local funders and commissioners. Here in Sunderland, though, we've been blessed for a number of years with an open, inclusive, honest relationship between the Council and our colleagues in the National Health Service. This relationship has resulted in carer services here in Sunderland being the envy of many other parts of the UK. We must endeavour to continue work together here in Sunderland to keep that position where it is. There is without doubt a greater level of awareness and understanding about your circumstances as carers and your hidden contribution you make as carers to the city. That is a result of partnership working at the very highest level, where partners listen to the contribution to you as carers make at strategic meetings throughout the year. Neither the NHS nor the social care system could function the way it does without the contribution you make as carers. Here in Sunderland, your contribution is recognised, and Sunderland Care Centre will continue to speak for and with you on behalf of all carers in Sunderland. The challenge we all face is to ensure we continue to improve those services in extremely difficult times for us all involved in partnership working. The United Kingdom, the North East, and in particular Sunderland, faces its most serious financial challenge it has done for many decades. It will be vital to maintain the momentum of policy change and the creative translation of that change, which is what Sunderland has always been very good at. The numbers of carers in Sunderland are extremely high, and lots of you will understand the numbers that I talk about. 32,500 carers recognised themselves at the last census. That's people who recognise themselves as carers. We know within this room that people don't recognise themselves as carers, so that number is possibly massive compared to the 32,500. Sunderland is the 9th highest in the UK for carers providing 50 hours of care or more. That number includes carers who also work full-time or part-time, providing a level of care. Awesome figures, awesome figures. A joint report from the government recently in Carers UK and Employers for Carers highlights an estimated 315,000 working-age carers have left work and have remained unemployed at this point. 315,000 people have come off from working and are now not in work. We all need to recognise that central government affect the way our partners would like to operate. And it's the like to operate we have to remember. We need to recognise that while working closely with all our partners to reach agreement and understanding, that carers' needs are at times complex and ever-changing. Some of that change is a direct result of changes to the benefits carers are eligible to receive. The gentleman has just highlighted some of that. We continue to work very closely with our colleagues in welfare rights here in Sunderland to ensure carers receive up-to-date and relevant advice. However, the details of some of those changes to the benefit system is complex and can be seen at times as working negative towards you as carers. For example, the recent rise in the minimum wage last month has had a knock-on effect to carers who are earning a wage. It will mean carers who are working 16 hours a week will exceed the threshold for carers allowance and will no longer be able to claim it. Those affected are caught in a kind of a catch-22 situation, because by reducing their hours to less than 16 hours per week, which would bring them back under the threshold for carers allowance, that would result in them losing their tax credits. It's a ridiculous situation and has been picked up by national carer organisations such as Carer Trust, which Stuart has just highlighted. There has just tweeted us to say good luck for this afternoon. So Carers Trust have picked that up. Carers Centre is a network member of Carers Trust, and we will be lobbying central government on your behalf as carers. But that sounds very grand in terms of lobbying government, central government. It's important to recognise the importance of that lobbying role Sunderland Carers and other organisations have. Because this week, the Secretary of State for Education, the Right Honourable Michael Gove, proposed an amendment to the Children's and Families Bill that will make significant changes to the legislation regarding young carers. So the campaigning work here in Sunderland continues for us to make more legislative changes and to make sure that the effect of some of those changes is not borne solely by you as carers. As I stated earlier, I've been in the post for close on a year now. The commencement of that role saw the coming to end of Sunderland Teaching Primary Care Trust, and in April 2013, the Clinical Commissioning Group commenced its work here in Sunderland. Sunderland Carer Centre looks forward to working with the new organisation. Indeed, we've already been involved in a very exciting initiative that sees all GP practices identifying a carer's lead and seeking permission from carers to pass on their information to us here at Sunderland Carer Centre. This is a fantastic step forward to what has been in place prior to this project. Now I've got here to explain the conversation. So I know I explained the conversation, how the conversation between a GP and a carer might well have gone in the past. The carer would have been recognised by the GP in normal circumstances. And perhaps the conversation might have gone, I recognise you're a carer and I can see you need some help and support. Why don't you, I'll give you this leaflet, which is for Sunderland Carer Centre. Why don't you give them a ring? I'm sure they can help. That's fair, that was a fair conversation. But the conversation we hope now goes with this new project. Through conversations with the carer, the GP will say, I recognise you as a carer now, and we work very closely with Sunderland Carer Centre. Is it okay if I pass on your details to Sunderland Carer Centre? Now that's a massive change for us. That will enable us in Sunderland Carer Centre to commence a relationship at an early stage with new carers, while also engaging with some carers who may very well have been struggling in isolation. And I know many of you in this room consider the early contact with Sunderland carers so important in your role as carers. Recent findings recently in the Carers Week, where 2,100 carers were interviewed, states 8 out of 10 carers were not aware of the support available to them because of the time it takes to identify themselves as carers. 35% were given the wrong advice due to the time it took to recognise themselves as carers. The GP project that we're working closely with CCG will recognise and have an impact on the health of carers, and we'll be able to work very closely with carers at that stage. The Carers Week survey also said 6 out of 10 carers have been to see their GP as a direct result of their caring role, and that might be physical. 9 out of 10 carers felt more stressed because of their caring role. Sunderland Carer Centre is Sunderland City Council. Sunderland Carer Centre is extremely excited by the project because of the potential impact it can have on large numbers of carers early in their caring role. And I'll continue to update you all on the progress of that through newsletters and Twitter and Facebook and etc. It's also really encouraging to see carers as a priority in both the health and wellbeing strategy and the 5-year plan for the Clinical Commissioning Group. The CCG have been active and considerate in their partnership arrangements with the Carer Centre, and I am committed to ensure that the relationship with CCG continues to flourish. Because if it does, Sunderland Carer Centre can continue to influence the support for you all in your caring role for years to come. We've also had some great success with our partnership arrangements with Sunderland City Hospitals. Staff from hospital work alongside staff from Carer Centre to improve the experience of the many patients and carers who attend hospital. Indeed, in June 2012 last year, the hospital launched its Carers Charter, stating the intention to value the carer role as an expert in care delivery, and in particular, the very complicated process around discharge that can occur. Carers Reference Group meets regularly with hospital staff to discuss areas raised by carers. These areas include outpatient arrangements, parking issues, and many more operational issues. Another area of success in that relationship with some hospitals is that carers have been included in the recruitment process for new members of staff in the hospital. So it's a fantastic relationship at the moment with Sunderland City Hospital. Our work with Sunderland City Council continue to be another successful area of partnership working. However, we recognise the massive changes they've had to make to adhere to severe budget cuts, and that cannot be easy. They've been forced to make those changes to balance their books with government auditors. Even this week we've seen further cuts to that budget. This will no doubt have an effect on how services are delivered. However, you as carers, please be confident that your views will be considered through the many mechanisms we have at Sunderland Carers Centre to contribute to that agenda. It's also worth noting that Sunderland City Council, through both adults and children's services, want us to feed in your views and experience. The new People's Directorate, which include those areas, have always been supportive of the relationship with Sunderland Carers Centre. Sunderland City Council have been instrumental in commissioning breaks for opportunities for carers for a number of years, going back, I think, to around about 2000, the year 2000, when it was called the Holidays and Opportunities Program. This type of intelligent commissioning was recognised as good practice nationally and rolled out, and we now have the Carers Breaks and Opportunities Scheme. This year we've seen our 1,000 applicant and 1,000 award of money for people who have received that money. And indeed, in the 6 months from April to September this year, we've made 589 awards to carers for a break or an opportunity. And I'm sure you'll agree that's a fantastic support for you as carers in Sunderland. We as residents in Sunderland are not naive enough to think that some of the changes having to be made will not be negative. But I'm confident that anything that can be done for carers will be considered by our partners. Indeed, during this year, councillors have chosen support for carers as one of the areas they want to scrutinise, and then to make recommendations to all partners in the city. It was great to host a visit from a group of councillors at the centre only last month. We met staff and carers, and as we do at Sunderland Carers Centre, the day ended with some lovely cake and tea. But it was lovely cake, honestly. Sunderland City Council have always been honourable in their attentions to support for carers, and I see no reason for that to change. Indeed, I think through adversity, partnerships can be strengthened for years to come. I'd also like, Stuart mentioned, to thank personally Councillor Ian Kay and his wife Barbara for choosing the Carers Centre as one of their charities last year, and hopefully I'll be able to announce what we're going to do with them money very soon. I also want to take the opportunity to thank all the staff at Sunderland Carers Centre who have welcomed me into my new role. I've no doubt a number of staff would have wondered what a new manager would do and how it would affect their roles. But hopefully the staff will realise that my drive is, and always will be, in achieving the very best for carers here in Sunderland. I want to thank the senior management team at the centre who have embraced some early changes to their roles and responsibilities, and thank the growing number of volunteers who support the work at Sunderland Carers Centre. I know the fact we have a wonderful site at Thompson Park will enable volunteers to become involved. But I'm committed as well to grow our staff volunteer base to support staff and volunteers at the centre and in the city-wide communities we operate in. Stuart mentioned the recent mindless vandalism we suffered at the centre. What has happened through that has made me realise how many of you as the general public and carers value the work of Sunderland Carers Centre. I've been overwhelmed with support, physical and practical support, and indeed financial support through areas like behind me. And I'm committed now to rectify that damage and make sure that the site is more secure. I'd also like to say all of you the kind words on Facebook and Twitter, which is a new venture for us, and the telephone calls and the cards we've had, all about the damage. Sunderland Carers Centre Board, chaired by Stuart, should always also be recognised towards going now for their commitment to keep a watchful eye on the strategic direction of the centre and the development services for years to come for carers. So it leaves me to say thank you for listening, and I think you can stop calling us the new boy now. I've gone beyond that now. I'm the Chief Executive Officer of Sunderland Carers Centre, and extremely proud of the team at Sunderland Carers Centre, and proud to represent you as carers here in Sunderland, hopefully for years to come.